The largest hospital system in our state is now calling on hospice companies for help. Journey's Hospice in Nampa tells us that St. Luke's has contacted them to ask them for help as the hospital system is looking now to discharge patients expected to soon die. Andrew Bartline has been following this story for us today. And Andrew, the question, what did Journey's Hospice have to tell you?
Yeah, when someone is expected to die in a hospital, hospice care is an option for that person to pass away at home with their family. And while St. Luke's has their own hospice care, they're looking for outside help for this service that they already provide. Journey's Hospice says they've never seen anything like it. The Idaho Department of Health and Welfare continues to report our Idaho hospitals are overwhelmed.
The number of COVID-19 patients continues to exceed the healthcare resources available.
And one of the more recent fallouts has been the discharging of patients into hospice care.
They've exhausted all their treatment options. There's nothing else to do except die in the hospital, and they would rather die at home.
Jessica Velasquez is a registered nurse and the owner of Journey's Hospice. She says St. Luke's has reached out to Journey's 3 times since Labor Day weekend asking for help.
The girl who called was assigned to call all hospices and just get some data as to who was fully staffed, who had availability to take patients, if we had access to high flow oxygen.
Velasquez says it can be a financial risk to take a patient that's expected to die very soon. That's because a hospice company will often lose money as a result. But to Journey's, they say this is about more than money.
We'll take them. Free up that bed.
It's about taking care of people and their families in some of the most difficult times.
How do you have a conversation with a family or a loved one when you're trying to tell them that your dad is passing from something that could have been prevented?
Health and welfare numbers show Idaho has record high patients in the hospital and ICU last week.
We expect these numbers to continue to increase. We do not see where this is going to turn around just yet.
So as hospitals need open space, Journey's is ready. They are fully staffed and working diligently to ensure they have the proper equipment to care for these discharging patients when needed. Because those who move into their care will truly be on their last days.
We're here for any COVID patient who wants to go home, whether they're home for an hour, whether they're home for a week. That's what we do.
I asked Journey's if there's been a change to the kind of patient they've been seeing right now. Journey's tells me they are seeing younger patients than normal, but it hasn't been significant. They say their average patient range is still between 60 to 99 years old. Mark?
Right, and a lot of them with cancer as well. All right, Andrew, thank you.